Li Changhai, Director General of Hubei Provincial Department of Housing and Urban and Rural Development, and Mr. Cu Yuanchao, Deputy Director General of Hubei Health Commission, and Mr. Li Yang, Deputy Director of Hubei Provincial CDC. May I first give the floor to Li Yang for him to update you about the latest situation of COVID-19. As of March 12th, Hubei had a total confirmed case of 67,786 and 49,981 are from Wuhan, accounting for 74% of the province. The remaining parts of the country accounts for 26% of the total confirmed cases in the province. For yesterday, we have reported 5 new cases. The new case has been growing at a double-digit pace for 2 consecutive days, and we have reported no imported cases in the province. And for other parts of the province, for 8 consecutive days, there is no new cases, and Shenlongjia and Xianyang, Xiangyang, Xiantao, Tianmen, Suizhou, and Yichang, and Qianjiang City. For these 8 cities and prefectures, for 14 consecutive days, there is no new cases. As of the end of yesterday, we have a total of 11,808 existing cases, and 697 of them are in severe conditions. And as of the end of yesterday, total deaths in the province reached 3,062. And for yesterday, there were 6 new deaths. All of them are from Wuhan. And as of the end of yesterday, we have discharged 51,135 patients from hospitals. And yesterday, 1,103 patients were discharged from hospitals in Wuhan, accounting for 88% of the province's total. From February the 20th, for 23 consecutive days, we have more people discharged from than those that are confirmed. May I now give the floor to Li Changhai for him to update you about the treatment and control measures. Good afternoon. At this crucial moment of our fight against COVID-19, President Xi Jinping paid a visit to Wuhan. He gave us very effective guidances. And according to President Xi, there are 2 areas of focuses. One lies in hospital and the other lies in community. The province has been following through the important guidelines made by President Xi Jinping, and we are practicing closed-off management at communities. The Provincial Command Center issued a notice on further improving the closed-off management at communities. We focus on the services at the community level, and from February the 28th, there has been regular inspections from the provincial level, looking into the efforts of cadres and the community workers. This inspection has covered 57 cities in the province, covering 283 residential communities. Secondly, we have added to the capacity of communities, and the difficulty of closed-off management at residential communities lies in capacity and staffing, and we have mobilized cadres to go deeply down at the grassroots to work together with local officials. We are coordinating the centralized delivery, and we also support point-to-point service between different sites. At present, the residents have gone through a transformation of not being accustomed to this practice to getting accustomed to this practice, and everybody is committed to fighting till the very end. And third, we focus on key problems. We follow the principle of problem-oriented approach. We are working together with relevant agencies to come up with sufficient supplies and materials for the residents, and we also provide mental help and support to vulnerable groups in need. And for the next step, we will focus on three key areas. The first is to focus on areas with a weak capacity. We will mobilize our resources to focus on high-risky areas so that our service can cover communities and substreets and different cities, and government officials at different levels will be held accountable, and we will focus on open communities and also those shanty towns in the cities. And second, we will focus on key problems and focus our energy on those key areas, and we will guarantee services for elderly people living alone and people with disabilities, and we will also provide them with mental support so that we can stabilize the society by adopting a region-based strategy. We will look into the management strategies for different residential communities. In doing so, we can expand the activity space for the communities and gradually stabilize the society. And third, we are going to have dynamic management, and we have to have a knowledge about the information of people's flow, about when they return to their residential community and when do they start work. And in so doing, we can avoid slackening our efforts. Now may I give the floor to Tu Yuanchao, and for him to update you on our recent efforts in treatment. Good afternoon. With respect to medical treatment, I would like to brief you about the following. As is known by all, this epidemic is the fast growing epidemic that covers the largest area. This is also the most difficult one in terms of response. And this is a very severe public health accident, and President Xi Jinping has given us a lot of support in our fight against COVID-19, and he attaches great importance to medical treatment. And on March the 10th, President Xi Jinping paid a visit to Wuhan. At the moment he landed on Wuhan, he paid a visit to Huashinshan Hospital and had a video conference with the medical doctors in that hospital. And he said that the medical doctors, they are the most respected people in this new era, and this fully reflects the great care from the party secretary to the people. And his visit has also encouraged medical doctors on their fight against COVID-19. Under the leadership and command of President Xi Jinping, regions all across the country have supported Hubei and Wuhan with their medical staff and resources. All the medical supplies quickly gathered in the epicenter of the epidemic, and in front of this epidemic, all the medical doctors volunteered, and they are having a race with the epidemic, and they are fighting the COVID-19 and saving lives with joint efforts from all stakeholders. The medical treatment in this city has registered great progress. There is an increasing number of people discharged from hospitals, and for those hospitalized and new confirmed cases, both figures are going down. And as of the end of yesterday, we have a total confirmed case of 67,786, and 51,153 patients have been discharged, and 71% of the patients cured, and those hospitalized has been reduced to more than 10,000, and patients with severe and critical conditions are less than 10% among all patients, and the new confirmed cases has been declined to single digits. And for other cities in Wuhan, for 8 consecutive days, there is no new cases. So in general, in Wuhan and in other cities of Hubei, we have witnessed a inflection point, but still we have to admit that we face a arduous task, and we still have more than 10,000 medical doctors who are fighting on the front line, and there are 251 patients in in severe conditions, and hundreds more are in severe conditions, and those are the challenge that we face at present. In the meantime, we have to solve the normal medical needs of our residents. Well, President Xi Jinping was inspecting in Wuhan. He stressed that we need to put medical treatment in the first place, and we need to focus on scientific medical treatment so that we can improve the rate of treatment and reduce the mortality rate. And these are the very important guidelines made by President Xi Jinping, which is of great importance in this strategic fight against the COVID-19. And this is also a task from President Xi Jinping, and this is also the responsibility that we have to take up. In the next step, we will follow through the important guidelines made by President Xi Jinping and focus on the following 5 areas of work. The first is to focus simultaneously on medical treatment and control, and we are going to focus on the treatment of patients with severe conditions, and we are going to mobilize the best doctors and best supplies and the best life support facilities and equipments. In so doing, we will also summarize successful experiences, improve our medical treatments, and improve our overall capacity in medical treatments. On the other hand, we must also focus on patients with mild symptoms. By monitoring key indicators, we will put in place effective medicines and use both Western medicine as well as traditional Chinese medicine so that we can avoid mild cases evolving into severe cases. And for those remaining patients with mild symptoms, they will be taken care of and they will be transported to key hospitals so that we can improve the rate of treatment. And second, we are going to focus on the full process medical treatment. By combining Western medicine with Chinese medicine, we will be able to also improve the experience of treatment. And in the meantime, a monitor on patients will be increased, and will focus on the long-term medical needs of the patients. And for those discharged from hospitals, they will also be covered in our service. We are also going to establish clinic centers for patients that are discharged. We will formulate medical treatment handbooks so that we can guide discharged patients to do better self-care. And in the meantime, we are also going to provide mental support to the families of confirmed patients. And third, by coordinating with other hospitals that are supporting Wuhan, we're going to seize the window period of medical treatment, and we are going to step up our medical resources and capacity. By coordinating different resources, we are going to accelerate the transformation of designated hospitals for COVID-19 into normalized hospitals, and so that we can dramatically and very quickly improve and normalize the medical system of Wuhan. For other provinces, we are going to focus on the level of counties and cities, and a majority of the medical institutions will be normalized. In this process, we are going to step up our supervision so as to avoid hospital-affiliated infection. And fourth, we're going to increase our support to areas with weak capacities. Professionals. We are also going to improve our emergent medical treatment system, and we are improving the emergent response mechanism for epidemics, and we are strengthening the capacity at the grassroots level in response to epidemics. We are also strengthening training for doctors at the grassroots level. By putting in our heart and energy, we are going to guarantee their needs of daily necessities. By providing comprehensive services, we're going to minimize the number of infection cases. By improving Now the press conference is open for questions. I'm with Economic Daily. So what kind of role did those community workers play? First, we improved our system, and we designated special personnel to solve specific questions. And the efforts are coordinated by the party organization at the community level. To our knowledge, at the community, there is normally around 10 staff, but they have to meet the needs of thousands of residents. So we have to mobilize resources from all walks of the society, including volunteers and resources from other aspects so that we can coordinate them. We are doing daily quarantine patrolling and disinfection. And a mass prevention and control landscape was established. And discipline committees at different levels are also working together, and we made it very clear that those interim organizations need to have in place a party organization and party committee so that they can provide care to those party cadres and members. So for 8 consecutive days, the increased cases have remained at 0. And does this indicate that we are now at a turning point? What is the main efforts in the next step? Thank you very much for your question. On March the 10th, so when President Xi Jinping was inspecting in Wuhan, he stressed that with the great efforts of all of us, the prevention and control efforts in Wuhan have seen great results. We have to mobilize the medical treatment of both COVID-19 patients and non-COVID-19 patients. Hospitals need to collect patients, and the medical and the health system in Wuhan has to be normalized in the meantime to meet the ordinary medical needs of our residents. And the same will go to the hospitals in other regions in the province. And the second very important effort is to coordinate our medical resources so that we can extend more support to regions with a weaker capacity by using remote medical services and different technological tools. We hope to solve the medical needs of some very severe problems. In so doing, we are also going to avoid hospital-affiliated infection, and training at the local level for medical doctors will be strengthened. In the meantime, we need to avoid the occurrences of infections. We need to put in place a level-based treatment plan according to the risk ratings of different levels, and on the basis of assessing the infection risks, and on the basis of providing sufficient medical beds, and we have to normalize our medical system so that we can meet the basic needs of our residents for medicine. And we also need to disclose information to the residents with respect to available hospitals and beds so that our residents, they can have a lot of choices in going to hospitals. we are also going to improve supervision. Well, before recovering normal services, hospitals need to be guaranteed that they need to conduct a thorough disinfection efforts, and they need to formulate a plan to guard against hospital-affiliated infection. They need to streamline their stockings for medical supplies and to conduct a hospital-wide training, organize a emergent medical drill, and build a medical support team and conduct one comprehensive medical assessment. In doing all these efforts, we need to keep our door very well with respect to the special ward and the ward for infectious diseases, and we need to put in place a very serious disinfection practice so that we can avoid hospital-affiliated infection. I'm with Hong Kong Business Daily. There's a lot of question with respect to meeting people's daily needs, and what are the measures you have in place to solve this issue? Well, let me answer this question from the following aspects. First, we need to identify the needs of residents by focusing on residential communities. We will be able to carry out our efforts, and party members, they will be serving as the head of the team and head of the community party committee, by delivering services to people's doorsteps, and also by WeChat conferences, we will be able to understand what are the needs out there. And second, we will be able to have more a smooth connection between supermarkets and the community and communities, so that we can meet the needs of residents, no matter it is supermarkets or pharmacies or hospitals, so that their basic life needs can be served. In the meantime, the government will subsidize some of their needs, and we will also step up with our market regulations so that our residents, they can eat healthy food and secure medicines. And another very important aspect is to break through the bottlenecks within residential communities. Establishing WeChat group is a very good practice. We can immediately identify people's needs, and we can also support better delivery services to people in vulnerable groups, such as elderly citizens as well as people with disabilities. And for those impoverished families, there is some subsidies. And for patients with severe and critical conditions, there are special vehicles at some communities to transport those patients to hospitals. And we also need to guarantee safe and secure activities at communities. For example, they need to put in the garbage in designated places so that we can avoid infection and avoid people gathering as a crowd. And we also need to offer a lot of notices and advices. For example, people need to wear a face mask so that we can avoid infection. And we understand that there is still a gap. In the next step, we're going to narrow the gap. Thank you. Next question, please. I'm with Hubei Broadcasting Station. So Hubei is long renowned as a pharmacy of central China, and we have a reputation in Chinese medicines and Chinese herbs. Can you give us a brief introduction, the role of traditional Chinese medicine in fighting COVID-19, and how do we ensure that traditional Chinese medicine play a effective role in helping those patients recover? Thank you very much for your question. This is a very good question. We know that Hubei has profound culture in traditional Chinese medicine. Since the outbreak, President Xi Jinping has reiterated many times that we need to stick to a combination of Western medicine and the traditional Chinese medicine. We need to use both Western medicine and Chinese medicine. And this is a very important strategy which has pointed the direction for medical treatment. Under the strong leadership of hospital managers and health officials, traditional Chinese medicine played a very important role, and it's widely used in medical treatment. And it's also deeply engaged in all processes of medical treatments. And we have the following practices. First, in early prevention, traditional Chinese medicine played a very important role. And at the community level, we have distributed 430 prescriptions of traditional Chinese medicine to residents. And this medicine played a very important role in preventing the disease. And all the cabin hospitals were equipped with sufficient Chinese medicine. So Chinese medicine covered all the cabin hospitals, and this has mitigated the pain of patients and reduced the transformation from mild cases to severe cases. And we are also serving patients with critical conditions and severe conditions using Chinese medicine. And we have come up with strategies and put in our actions. By using traditional Chinese medicine, we have mitigated their symptoms. We have earned a lot of time in medical treatment, and for those patients recovered and discharged from hospitals, we are also using traditional Chinese medicine to help them better recover. And at those quarantine sites, we are using a lot of Chinese herbs to help those patients to better recover. And as of present, traditional Chinese medicine has been used in more than 90% of the medical treatment cases. And at cabin hospitals, Chinese medicine has been used by a rate of more than 99%. In 284 quarantine sites in Wuhan, we have a total of 11,750 people in quarantine, and traditional Chinese medicine played a very important role in helping those people recover. And by following through the guidelines made by President Xi Jinping, we have printed and circulated the treatment handbook by using traditional Chinese medicine. In the next step, we are going to improve our efforts in the following 4 areas. The first is to improve the medical treatment and recovery network by relying on efforts of designated hospitals and grassroots level clinic hospitals. We will conduct follow-up services to those discharged from hospitals. And second, by sticking to the combination of traditional Chinese medicine and Western medicine, we are going to organize professionals and experts to formulate a guiding handbook. And this handbook will be distributed to medical doctors so that they can use this handbook as a reference. And we are also going to release a handbook for the general public so that those who didn't go to the hospital can rely on this reference book to recover at homes. And third, we will strengthen our efforts in diagnosis and assessment. We care not just the mental health of those confirmed or hospitalized, and we also take into consideration the mental health of their family members. And fourth, we will actively combine internet with medical services, and we are using an information platform which is now covering more than 400 medical institutions all across the province. And we have another initiative which is covering all the hospitals in the province, and we also have in place some internet-empowered hospitals. And if you have a problem, you can go online to consult a doctor, and through all these efforts, we will be able to help a lot more patients recover. Now the last question, please. According to some reports, for some people with chronic diseases, and it's highly likely for them to develop into critical conditions. So my question is how those people with chronic diseases recover from home. May I ask Mr. Yang to address this question? Mr. Li Yang, please. So for chronic disease carrying patients, this chronic disease can be recognized as a pre-existing condition, and for those type of patients, recovery is relatively more difficult. And if you stay at home, it's highly important that you have very scientific self-medical support, and you need to pay special attention to those areas. First, you need to lead a healthy lifestyle. You need to pay special attention to personal hygiene, open the window to breathe some fresh air, make some exercises, relax, but you need to avoid going out. And for those patients with chronic diseases, you need to do some workout. For example, on an average day, you can do some 30-day exercises. You can practice Tai Chi, and you can also do some physical exercises indoor. Looking at your blood pressure, you need to also regularly check your temperature and other symptoms, for example, breath.
那么第三块呢，就是在这个疫情期间呢，这个特殊的时候呢，我们要学会如何来进行就诊啊。在疫情期间呢，我们很多医院都开通了这个线上的问诊。线上开方的这样的服务，那么我们患者呢可以进行这个线上问诊，由医生呢开具药方以后呢，再到定点的这个药店呢购药。如果呢我们的这个药吃完了以后呢，不需要这个调整药物的话呢，我们应该呢把这个药方保留好，这个凭这个药方呢也可以直接到药店去买药。同时呢，我们还要注意呢。这个储备一些这个心脑血管方面的这个应急的药物以备不时之需。此外呢，现在
They can also stock up on some medicines, and different hospitals are working out long-term effective prescriptions for those patients with chronic disease. and the prescription can be extended to 12 to 14 weeks. And this can effectively help patients with chronic disease to reduce the risks of crowd gathering at hospitals. And people with chronic disease, they also need to know how to identify their personal health state. They need to be aware of their personal health indicators. To just give you one example, those who are suffering from high blood pressure, if you have a pressure larger than 180, then you need to pay special attention. And if there are some drastic changes of those indicators, for example, if you have eyesight issues or short breath or other diseases, then you need to pay special attention. And if you are suffering from diabetes, if you have some swollen parts in the body, and if you also, for example, suffer fast heartbeats or fever, then you need to pay high attention. If there is an emergency, you can dial the health care hotline of 120. And if you discover that you have some problems of raising your arms or you have language problems, then you need to get in contact with hospitals immediately. And if you have short breath and other chest-related issues, thank you very much. And this is the end of today's press conference. Thank you.